If your toothbrush ever starts looking anywhere even close to that, it's time for a new one. Come with me and I will show you exactly how I pick my own brushes. They say you should usually swap a toothbrush every 2 to 3 months. However, it heavily depends on your technique, how hard you brush, if you have braces, etc. So use your eyes. Okay, so that was a bit of a joke, but you get the point. It doesn't matter which toothbrush you use. New age, electric, manual, it doesn't matter, just use one. Everything else is just personal taste and marketing. Okay, so let's get to it. So what are your choices? Well, first of all, there are all kinds of toothbrushes with all kinds of different shapes to them. Better massages your gums, it cleans between your teeth better. It does nothing. You throw it away. It literally does nothing. Just ignore that part. Okay, the next one. There are many toothbrushes with some kind of rubber in between or around the brushes. It also does absolutely nothing. This one, they call it a polishing star. Helps whiten the teeth. It does nothing. It literally won't help with anything. If anything, if the rubber is kind of hard, it will do more harm than good. So we throw it away. Both of these are pure marketing and aesthetic. If you like that kind of aesthetic, just go for it. There is no reason not to use them. I will use all these brushes I bought for myself at some point. It's just that's not something I prefer. Okay, now on to the things that actually matter. Kinda. A bit. They matter just a bit. So the toothbrush can be soft, medium and hard. This is the hard one. I don't think anybody should be using a hard toothbrush, so let's throw that one away as well. Now, medium and the soft one. For the most part, everybody agrees that most people should just use a soft toothbrush. Medium one is kinda a bit better for brushing those flat surfaces of the teeth, getting rid of pigmentations from coffee and stuff like that while they're forming, not after they have formed. However, at the same time, I found research that suggests that the medium toothbrushes are a bit more damaging on if you have something like composite fillings or composite veneers. They will damage them more easily, and they kind of show some difference in damaging the enamel, but personally I don't really buy it. If you like medium toothbrushes more and you don't have any current problems with your gums, then feel free to use a medium toothbrush as well. However, most people should just use a simple soft toothbrush. I personally use just a flat soft toothbrush with nothing fancy on it. Okay, let's talk a bit about manual versus electronic toothbrushes. Electronic toothbrushes were initially developed for special needs patients. So patients that lacked manual dexterity to use a manual toothbrush. Initially, I was completely against using electronic toothbrushes. The reason was they had a rotating motion. I did not like that, since a rotating technique is one of the techniques we use for manual brushing as an option, and it's not an ideal one. It's not ideal for cleaning anything other than flat surfaces of your teeth, and it's not the healthiest option for your gums either. So I was completely against a toothbrush that's using a rotating technique, and it brings it to a whole different level with the number of rotations per minute. However, while rotating toothbrushes still exist, now they also have a so-called oscillating rotating toothbrush. That one, in my opinion, and the most of the research agrees with me, is that it's fine. So with this kind of toothbrush, there is a sort of that kind of movement as it cleans your tooth. Whether electronic toothbrushes are better than the manual ones, studies are inconclusive. They either report no difference or a statistically significant difference. What does that mean? That means the difference between manually brushing your teeth and brushing them with an electronic toothbrush is over 5%. So 5% is still, in the grand scheme of things, nothing. Also, honestly, you have to factor in that a lot of these studies are done by companies making those toothbrushes, which are much more expensive, so take that for what it's worth. I will also quickly mention the new kind of toothbrush, ultrasonic electronic toothbrush. All the studies I found on them are inconclusive. Some report having better results than electronic and manual, some report same results, and some report having even worse results than the manual toothbrush. What that usually means when we are talking science, it usually means there is no difference when we have studies that are all over the spectrum. Considering the price, I would steer clear of them for now, and if I find any strong evidence for them, I will let you know in the future. So let's get to the beginning of the video where I said it doesn't matter. It truly doesn't. If using an electric toothbrush with an app attached, or if using a manual toothbrush with a Batman or Elsa, it will make you brush more regularly for the longer period of time, then use one. For electronic toothbrushes, in my opinion, just make sure that it says on the box that it's a rotating, oscillating toothbrush. That's all that I require from it. In conclusion, for most people, you should just stick with a simple, soft manual toothbrush. And if you want an electronic toothbrush, just make sure it's again, oscillating, rotating toothbrush. If you like this video, please leave a like. This was Dr. Vladan Stojanovic, your everyday dentist, and I will see you in the next video.